80% of pregnancy-related, 80% of pregnancy-related and pregnancy complications and related deaths are preventable. And sometimes keeping moms and babies alive and healthy comes down to community support, education, and resources. And all of that is available at a community baby shower this weekend. So joining me now to talk more about these efforts to support families in general, we have Dr. Pauline Roll and Mia Jones with us, CEO of Agape Family Health Center. Thank you all for joining us.
Thank you so much.
Experts on this topic, so I'm glad we can kind of roll in some ways that people can help and tap in and prevent some of these deaths. Let's talk about what's happening as far as these complications. Why are we seeing some of the numbers that we're seeing when it comes to maternal health, Dr. Roll?
Well, we're seeing a lot of that because women are going into their pregnancy with poor health to start. Some of them have chronic disease like obesity, diabetes, high blood pressure. A lot of them have poor nutrition. They're facing social determinants of health that have contributed to their poor health over time. And so they're going into their pregnancy unhealthy.
Yeah, now, and there are a lot of organizations that kind of work with women even before they're ready to have babies so that they can address some of those issues. Can you speak, Mia, to some of the services that are available at Agape Family Health?
Absolutely. Agape Family Health is a federally qualified health center. We provide primary care to the entire family. And regardless of your ability to pay, we're going to be there, we're going to receive you, and we want to be able to start that relationship earlier before moms are ready to have babies and then long after the babies are born.
Yeah, we can't, you know, insurance is problematic for a lot of people, being able to pay. So to have an option in the community that truly understands that and treats you the way you should be treated regardless of your ability to pay is really amazing. What are some of the biggest challenges or barriers to a healthy pregnancy? And I know we want to talk more about what people can do to actually make sure that they go into pregnancy healthy.
So access to health care is one, but that's not necessarily the biggest factor. It's those things that intrinsic to the woman. So poor nutrition, access to food, stress, that's a part of the problem. The environment they live in also contributes to that stress factor. Not having access to things like safe walking spaces to be able to exercise on a regular basis. Health literacy, huge issue. If I don't know that I have to take this medication for this problem that I have in order to be better, I don't understand the instructions, that also contributes to poor health, which leads to poor outcomes in your pregnancy.
Wow. All right, so next week starts Black Maternal Health Week, and you know Black women are dying at nearly 3 times the rate of white women during childbirth. So why are we seeing that disparity?
Again, going into it, just high blood pressure, diabetes, obesity, and also not recognizing the signs that there's something wrong, like persistent headache, belly pain, chest pain. There are all kinds of symptoms that women experience, and sometimes they just let it go, oh, it's okay, it's just heartburn, or it's just a migraine, and things of that nature. Pain in the legs could indicate a blood clot.
Right, you got to ring the alarm.
Yes, exactly.
And have that relationship with your doctor.
Have that relationship with a doctor.
Yeah,
yes.
Yeah. Community baby shower, let's talk about it, because this is not the first year that this is being done. I imagine every year getting better and addressing things that are really pertinent to women who are pregnant.
Yes, what we've recognized is that women need advocates. All patients need advocates, and oftentimes when you're not comfortable talking to your doctor or you're not understanding what your doctor is saying, you don't always know what questions to ask. So at the baby shower, we'll have a panel discussion where we'll be able to hear from experts and give the moms an opportunity to ask questions, to get some information that will assist them in being able to be advocates for themselves, but also to look at services of doulas. And to say, okay, this doula is there with me, and the doula knows because they do this on a regular basis, so they know what questions to ask. And when that mom says, you know, I don't feel quite right, something isn't quite right, when that doctor doesn't respond and look further into that,
the doula
that
can
doula
be the
can
voice,
assist in being their voice.
And a lot of other resources available this weekend as well. All right, so let's let them know. Community baby shower, it's doing your part for a healthy start. And again, it's tomorrow at 5:30. It's at the YMCA, so a partnership there as well. Alpha Kappa Alpha Sorority Incorporated, Gamma Rho Omega chapter. along with Agape Family Health, is putting this together. You guys have done this now for several years, so we know it's going to be excellent. So thank you for sharing. Also giving us hope that we can do something about this and keep moms and babies alive.